So in this pandemic world that we're in, things have changed a lot for primary care, and that this is going to be our normal for a long time, I think. And the pressure, we all know the pressure on the health system prior to COVID was huge, but also certainly post-COVID and lockdowns and isolation and a reduction of face-to-face consults, things have changed a lot. So what we do know now is that this far down the road, routine screening is impacted, secondary treatment of chronic and acute health issues have been impacted, and people's physical and mental health issues have been impacted greatly, especially in the last 2 years. So it's a really interesting sort of time for people in general practice and primary care to see how do we continue to provide healthcare to people in the less conventional method of rocking up to your GP clinic and having a face-to-face appointment. So just a little bit about us, just so you're aware, because some of you may not have heard from us for a little while about these things, but we've got over 600,000 downloads on mobile devices, and that's split over both Google Play and Apple. We've got over 1 million registered patients, which is pretty amazing. And we're only one of 11 platforms that the Ministry of Health have a sponsored data program for, which means that there's no data cost to access ManageMyHealth on mobile devices for you or your patients. And that's really feeding into what equitable healthcare is about. So it's for everybody. Our users based on gender sit around 60-40, weighted more towards women, but we've seen that trend to be leveling out over the last couple of years, which is quite interesting. And finally, based on age, our users are very similar. So there is no predominant age group that is shown to be high consumers of the patient portal at all, which is really reassuring for us. And what this all means is that ManageMyHealth isn't really aimed at a particular person or a type of medical centre or people with certain medical issues. It's really well suited for everyone, all ages, genders, stage of life, and levels of need from their primary care providers. So what we want to do today is just to make sure that you're aware of the things you can use and change to suit your practice and make sure that your patients get the benefit of this tool that you have. Now, this is starting off at the very basics, but just in case people aren't aware, the ManageMyHealth icon is found, whether you're in MedTech 32 or Evolution, the icon appears on the toolbar that you can see either next to the patient's name or on the pallet itself. So you can see there that orange means that the patient's not enrolled in ManageMyHealth at all, and it's a good time to talk to them about it or give them a pamphlet or whatever you might have. Blue means that they're not registered to ManageMyHealth, but they might be registered to MedicAlert or Beating the Blues or in the shared electronic health record. So we still treat that like an orange. They do need to be talked to about the portal. Yellow means that they've registered at some point, but they've not activated their account yet. So for these ones, you can prompt them to activate, or you might want to resend the activation email to them. And green is what we're aiming for. So registered, active, using the features that you've enabled for your clinic. So that's what we're wanting to see. So starting off with phone appointments, this has been a fabulous tool, obviously, throughout COVID. A lot of providers are happy to have phone consultations in lieu of face-to-face or video calls. And we've really seen a large spike in people using phone consultations, which is great. So you can access this from your system admin menu. So on the screen here, you can see I've highlighted where it says phone appointment settings. So here you can choose whether you want all your appointments that have blank session names in your appointment template in either Evolution or MedTech 32 to appear as phone appointments, or you might want them to be specific to session names that are called MMHPA, which I'm assuming is ManageMyHealth phone appointments. So that gives your providers flexibility on when they'd like their phone appointments to be available. So for some people, they've got their providers working from home a day or so a week, or even in some practices, particularly in areas of hotspots like Auckland, they've split into teams. So providers split their days into mornings and afternoons where they alternate remote consultations and face-to-face appointments. So you can control how that works in your clinic depending on how you guys are working. Moving on to video consults. So some providers obviously prefer to have some form of face-to-face interaction while offering a remote consultation, which is where video consultations come in, which is fabulous. So this is from this menu here is again under the systems menu. You can see it says video consultation settings. And on this form here, you can see what we recommend, the default recommendations are, but you can change that to suit your practice as well. And if it doesn't work for you, or if you do have a question about how that setup might work better or issues that you may be having, just reach out to us and we can help walk you through that process. So the next one is appointment message. So this allows you to communicate information to your patients, essentially. So it can be set up according to the login type. So it can be, and this is the screenshot here, either for people that have logged in on their mobile or on the website or easy booking. Or you can have a separate appointment message by appointment type. So you can do an appointment message for phone consults, an appointment message for video consults. So you might want to say, if it's a face-to-face appointment, when you arrive for your appointment, please phone the reception and stay in your car until you're directed to come in. Or if it was a phone appointment message, you might write, please ensure we have the correct phone number and have your phone switched on, not on silent, at least 5 minutes prior to your consultation. So it's just tailoring the messaging to your patient based on what the appointment is that they're having. The next one is appointment settings. And so this is, a common statement from practices is that they don't want patients to be able to book in with anyone, or the complete opposite, and they want patients to be able to book in with everyone. So we can support both scenarios or a combination, whichever suits your practice. So for practices where providers are quite firm on not seeing each other's patients, unless they're on leave or something like that, you can choose, and this is under where it says location and provider selection restrictions. You can restrict the bookings to only the patient's default provider. Other practices who don't work that way want patients to see whoever's available. They can choose to have no restrictions, or you might want patients to only book in with their default provider, or some providers that have no restrictions. And an example for practices that use registrars, you might want to direct patients only to their default provider or the registrar that's working in your clinic at the moment. And that also helps to keep their appointment books nice and full. Obviously, they're there to see as many patients as they can. So again, it's not just the settings that you have when you go live with ManageMyHealth. You can come back and change things that might not work for you or might work better in the future. The next topic is patient demographics. So patients who are registered and active users can also update their demographics from their login into the portal. And that's a really good thing for your practice because obviously it's less admin for the receptionists. You can also send a group message, which I'll talk about in a couple of slides, but you can send a group message quarterly to remind patients to update their details if they need to. That saves time for people asking at the front desk to confirm details in person, or if you're printing out consult slips, hopefully not printing out consult slips, but if you are, then you don't have to ask every person to confirm their details. But most importantly, it captures those people that don't attend your clinics very often, because those people often miss out because they don't get that face-to-face interaction with your team to be informed of all of this stuff. So group messaging is a really good tool for that, and making sure that they update their details irrespective of whether they come and see the doctor regularly is a very good thing. Often you find out that you don't have the patient's correct details only once you're trying to contact them for some reason and you can't get through, which is quite frustrating. The next slide is about online payments. So it's such a fabulous idea to use online payments for your practice. Anything that helps to reduce debt in your clinic is an amazing thing, but also people nowadays are so used to paying for things online, it's very normal. So you can set rates for your services all from the system admin menu. So you can see in the screenshot, there's two different parts to it as well. We really recommend that you enable this for at least repeat prescriptions. So many practices have issues with patients, particularly those that request a prescription but don't collect it, then not paying for that repeat prescription. And it's really hard once someone doesn't pay their bill to recover that money. It takes a lot of time and effort. So we want to help drive down debt write-off or bad debt by asking patients to pay online. And like you can see there, you can choose whether you want to enforce them paying online or just provide it as an option, whatever would suit your practice better. You do need a WinCave account, and if this is something that you do want to enable, we can walk you through that process end to end, so it's nice and straightforward. Right, so into group messaging now. So this is a feature that I think is possibly underrated. It's so useful. So group messaging is a great way to send information to either all of your patients or a portion of your patients via secure mail. So an example would be booster vaccinations are available to those that have had their second COVID vaccination before June. Or if you had decided that you were opening up a Saturday smear clinic from 10 to 1, please call reception to book. You know, that's an example of how you can use the gender and age filters to hit a target group of patients versus sending a notification out to all patients of your Christmas hours and shutdown period. So group messaging is very, very useful. So now on to lab results. So this is an interesting one. Sometimes practices and providers get a bit apprehensive to switch lab results on. They sometimes think that it might create confusion or stress for patients, but in practice, it's completely the opposite. So for the vast majority of patients and tests that are ordered, it's entirely appropriate to publish the result with a quick comment to the patient. And in fact, some lab providers in Auckland here at Lab Tests, patients can request a copy of their results direct from the lab, and so they get their results the same time as the doctor does with no clinical context whatsoever or comment. So it's something that people are already accessing in some cases. Now you can see on the screen, here's the setup. So there's evolution on the left and MedTech 32 on the right. You can choose whether you have that switched on, and the date field there is when you want lab results to be synced from. So whenever you have a date range, it's always a good idea to start it from either a day now or a day in the future. We don't recommend doing retrospective dating because obviously you want to give your providers an opportunity to say, as of Monday, all the comments that you write in your lab results will be syncing to the patient. So just to give them a little heads up, that's patient's going to be seeing what you write in the comment section. For patients that are the exception, so whether the patient themselves is not an appropriate candidate to have lab results published in their portal, or you might be ordering a type of test that definitely requires a consultation and a lot of explanation by the clinician, there are ways to manage those exceptions without taking that service away from everybody else. So if that's something that you would like to discuss further, we can definitely talk to you individually on how that can work for your practice. If the clinicians or providers have any questions or concerns that's stopping you from using it, again, just pull us in so we can help understand what they are and clarify things. Recalls. So I had an interesting conversation in the office the other day actually about sometimes if you ask certain people in the practice, how do your recalls go? Are they going well? Is it sort of busy and stressful? And depending on who you ask, the answer will be, no, we've got a great process. It's not a problem. Often 99.9% if you ask the nurse, they will say it's a nightmare. We have huge numbers of recalls to do. And that's, I mean, nurses are very much in the world of recalls. So using ManageMyHealth Secure Mail as a way to recall the patients for their routine screening is fabulous because there's no associated cost to it, for one, but also practices that are really successful in registering a majority of their patients on the portal, it means that they can recall their patients with one click, which is fabulous. So what you've got on the screen there is an example of where the inbox, outbox document setup is in MedTech 32. So all you need to do is have your document set up in a ManageMyHealth format. So you'd have a smear recall for ManageMyHealth. In your recall contact list, click the ManageMyHealth Send Secure Mail, and to every patient that's on the portal, it will, and in that recall contact list, it will send a secure mail recall letter out. A great thing about that as well is that you can see when a patient's received that recall, and they get a link to book an appointment in that recall itself. So for someone who is a busy working woman who's getting her smear recall, you'd receive that, you can click a link that says book appointment, and I can make that appointment straight away while it's fresh in my mind, without putting it on my to-do list that has 600 other things on it. Other things to note about recalls is that it all writes back obviously into the PMS. So then the patients that aren't able to be reached by ManageMyHealth Secure Mail, you can then choose to either use services that are additional charges like SMS, or require a bit more time, like printing and posting letters. So next I'll talk about batch registration. And for some of you, especially if you signed up to ManageMyHealth some time ago, you may not be aware of this. When previously you had to invite patients one by one. So usually that would be the receptionist at the front desk that would be inviting patients to come in, explaining what the portal is and that sort of thing. And that's still an option. So obviously you can still do that. But we've adjusted our implementation process in the software where we can now batch register patients, which means we can invite groups of, I think, up to 1,000 patients at once for you. And that doesn't matter if you've joined us 5 years ago or if you're a new customer. So if that's something that you'd like more information on, you just need to reach out to myself, Fran, or Tyson, and we can walk you through that process. It's a really good thing to do. It means that, again, like I said before, it's health equity. It means every one of your patients is getting the chance to take up the service offering, not just the patients that come into your clinic regularly. It's not, they still have to activate, so they are invited to activate their account, but from your end, the admin side is much lighter, which is obviously way more preferable over anything that's a heavy admin load. So it only includes patients that have a registration status of R. You can exclude patients that are under 18 years old, and you can export the list of patients to an Excel sheet. And you can also get a list of people that choose to opt out as well, which is great. This slide here is on patient resources. So this is under the practice menu. And this has got information sheets on lots of common conditions, all aimed at patients. They're managed by the Everybody patient sheets, and they're so good for your patients. They save time and money, obviously, for printing, but it means that you've got a nice place for your information sheets for your patients, all in, we're sort of moving away from the Perspex holders on the walls in your waiting room. And it means that patients have access to them all the time, which is really handy. There's also a link in there now to the Ministry of Health COVID-19 website, which is very useful, especially when you're directing patients who perhaps are receiving unwarranted information or misleading information. You can direct them through to that link there, and it goes straight into Ministry of Health COVID-19 information. So that's really good too. So I thought I'd talk a little bit about how to promote this within your clinic, because this can sometimes be a bit tricky. Often the key stakeholders from our perspective, the people that are involved in the implementation, aren't the ones that are talking to patients about it. So there is a little element of explaining it to your team and making sure they're on board as well. And we know that you're busy, and so there's never really a good quiet time of the year to take on promoting new services and tools to patients. No one's sitting in the clinic twiddling their thumbs. So reminding staff doesn't work that well when you've got a to-do list that's longer than your arms. But we've come across some really good tried and tested ideas that other clinics have done, which seems to work really well. So one of them is in-house competitions. So this is where the front desk have got, obviously they interact with your patients more than anyone else in the clinic. So they're an incredible asset to you, but they tend to be very busy, obviously, as well. So sometimes an incentive to bump this up the priority list can be good. And that can either be individual, so the receptionist who registers the most patients might win, or you might have a target that you're trying to reach by the end of each week. And if they reach that target, they get a free lunch, nice bottle of wine, chocolates, all of the above. So another idea is practices use for their nursing teams and healthcare assistant teams, which is where they pick a day a week. And on that one day of that week, they talk to all their patients about the portal. And so again, it's quite unfeasible to say to a nurse, can you make sure you speak to every patient every day that you see for the rest of this year about Manage My Health? But it's okay to ask of that for one day a week. And it might be that I've got 15 booked patients today and I'm just going to make sure I give everyone a pamphlet, or I might just check everyone's icon and make sure they're registered and only talk to those that aren't. That works very well. And then finally, obviously, we've got a lot of promotional material that you can use, and that's really useful for the front desk or in waiting rooms, bathrooms, treatment rooms. For people that have printers in their rooms, pop a pamphlet next to there, so when the provider's ordering a lab test, they can give the patient a pamphlet with their lab order, and at least they can have a little read of it. So again, it's just making sure that you've got the buy-in of your team as well, because this works really well the more of your patients that are signed on, and you'll start to feel the real benefits, tangible benefits, like the phone rings less and the receptionists are not juggling 6 things at a time every day, the more patients that you have registered on the portal. And for your patients, the level of healthcare that they can access from your medical centre, whether it be face-to-face or remote, is wonderful. So the more people that have access to that, the better. I've just added this little slide in just today because I thought this would be really useful as well. So under the practice menu, you can see there on the left-hand side, the red box, it's got a link called product updates, and this is where we put all of our release notes. So you can see in there, if you the little blue click here buttons all the way through, that links through to our release notes for those functionalities that have come out. So the last one at the bottom for batch registration, it's got all the details in there about batch registration. So if you did want to read a bit more information about it before you contact us, that's the place to go to. And then this is our slide just showing our support lines. So there's obviously practice support. You've got quite a few options there. And then there's a patient support email address there, support@managemyhealth.co.nz. So you can pass that on to patients if they need it.